Most people think hearing loss is just about volume. If you can hear it, you should be able to understand it. But here's what actually happens for a lot of people. They finally get hearing aids, and instead of everything sounding clear again, they say, "Well, I can hear, but I still can't understand." And that's where this gets frustrating, because they assume something is wrong with the hearing aids. But in many cases, the issue isn't the ears anymore, it's the brain. Because when the hearing loss goes untreated for long enough, your brain starts to lose access to certain sound details, and that changes how clearly speech can be processed. This is called auditory deprivation, and if you've been waiting or thinking, "I'll deal with it when it gets worse," this is something you need to understand before you make that decision. What is auditory deprivation? Auditory deprivation occurs when the auditory centers of the brain are deprived of regular sound input. The human brain is highly adaptive, but also highly dependent on stimulation. Just like muscles that shrink when not exercised, the auditory system deteriorates when it isn't used enough. This is because the brain's neurons and pathways that decode speech and environmental sounds need constant activity to stay sharp. When hearing loss limits that activity, the brain begins to forget how to process certain sounds, and this skill becomes harder to recover later. For instance, if a person develops hearing loss in both ears but only treats one with a hearing aid, the untreated ear continues to decline. Even if a hearing device is added to the second ear years later, the brain may struggle to interpret the new input. This is because the auditory pathways associated with that ear have weakened due to a lack of stimulation. Causes of auditory deprivation. There are several reasons why auditory deprivation develops, but they all trace back to untreated or inadequately treated hearing loss. Bilateral hearing loss, both ears. When both ears experience hearing loss and no treatment is given, the brain misses out on large portions of sound input. Over time, this makes it harder to follow conversations, even in quiet settings. Unilateral hearing loss, one ear. If someone only uses a hearing aid in one ear, the untreated ear is left behind. Audiologists often warn against this because it creates an imbalance. One ear remains active while the other falls into deprivation. Delayed treatment. Many people wait years before seeking hearing help, often because they think their hearing loss isn't bad enough. Unfortunately, the longer the brain goes without sound, the harder it is to recover auditory processing skills later. Improperly fitted hearing aids. Wearing hearing aids that don't provide enough amplification, or not wearing them consistently, can still leave the brain partially deprived. Consistent and accurate amplification is key to preventing deprivation. Hearing is more than just sound waves hitting the eardrum. Once the ears detect sound, the information travels along the auditory nerve to the brain's auditory cortex, where it is processed and interpreted. When hearing loss limits incoming sound, the brain starts to reassign those unused areas. In fact, brain imaging studies show that people with untreated hearing loss often have reduced activity in auditory regions. Some of these areas are taken over by vision or other senses, reducing the brain's ability to decode speech and language. This neurological shift explains why some people say that even with hearing aids, they still can't understand speech clearly. The ears may pick up the sound, but the brain has lost practice in decoding it. This is the essence of auditory deprivation. It's not just about hearing less, it's about the brain losing its sharpness in processing sound. Consequences of auditory deprivation. Even after getting hearing aids, people who experience auditory deprivation often complain that voices sound unclear or muffled. This is because their brains are out of practice with speech recognition. Slower adjustment to hearing aids. New hearing aid users sometimes report that everything sounds overwhelming or unnatural. This is more common in people who waited years before treatment because their brains need longer to relearn sound processing. Cognitive decline. Multiple studies have shown strong links between untreated hearing loss, auditory deprivation, and dementia. When the brain is deprived of sound, it has to work harder just to decode speech, leaving fewer resources for memory and thinking. Over time, this cognitive overload contributes to decline. Social isolation. People with auditory deprivation often withdraw from social situations because conversations feel too difficult. This isolation further contributes to mental health challenges like depression and anxiety. Permanent changes. In some cases, if hearing loss is untreated for too long, the changes to the brain become irreversible. Even with modern hearing aids or implants, some of the lost processing ability may never fully return. Examples of auditory deprivation in real life: consider two patients with the same level of moderate hearing loss. One seeks help early, gets fitted with hearing aids, and wears them consistently. Over the years, their brain continues to process sound naturally, and they maintain strong speech understanding. The other patient waits 10 years before seeking treatment. By then, their brain has been deprived for so long that even after being fitted with aids, speech feels distorted, and they constantly ask for repetition. This contrast shows how timing plays a crucial role in preventing deprivation. Another example can be seen in children with untreated hearing loss. If hearing aids or cochlear implants aren't provided during critical developmental years, the child's brain misses the window for learning speech and language naturally. Even with intervention later, catching up is much harder. This highlights that auditory deprivation doesn't just affect adults, it can alter the course of a child's life. Research on auditory deprivation. Decades of research back up the concept of auditory deprivation. Audiologists often cite studies that show people with untreated hearing loss in one ear experience declining word recognition scores in that ear over time compared to the treated ear. In fact, once the auditory system starts to weaken, it often continues to decline faster than normal aging would predict. Neuroimaging has also revealed changes in the brain's auditory cortex in people with untreated hearing loss. These changes resemble patterns seen in early Alzheimer's disease, which may explain why untreated hearing loss is considered a major modifiable risk factor for dementia. Prevention and treatment. The most effective way to prevent auditory deprivation is to treat hearing loss early and consistently. Here are the key steps. Binaural amplification. If both ears have hearing loss, using two hearing aids is almost always recommended. This keeps the brain engaged on both sides, preserving balanced hearing and preventing one ear from falling behind. Consistent use of hearing aids. Wearing devices only occasionally is not enough. The brain needs constant sound input to stay active, so daily use is essential. Proper fitting and adjustments. Hearing aids must be programmed to the individual's hearing loss by an audiologist. Underamplification or poor fitting can still leave the brain deprived. Cochlear implants. For people with severe to profound hearing loss who don't benefit from hearing aids, cochlear implants provide a way to restore sound stimulation and prevent further deprivation. Auditory training. Just like physical therapy for the body, auditory training exercises help the brain relearn how to process sounds and speech. This can greatly improve outcomes after being fitted with devices. The bigger picture: why auditory deprivation matters. Auditory deprivation matters because it shifts the way we think about hearing loss. It's not just about volume or clarity, it's about brain health. By ignoring hearing loss, people risk not only their ability to communicate, but also their long-term cognitive well-being. Treating hearing loss early is not simply about improving hearing, it's about keeping the brain active, sharp, and engaged with the world. Hearing loss is not just about what you can hear today. It's about what your brain is still able to process. And the longer the brain goes without clear sound, the harder it can be to fully restore that clarity later. That does not mean hearing aids won't help, but it does mean that timing matters. So, if you've been telling yourself, "I'll deal with it later," it's just not that bad yet. Understand, waiting doesn't just delay the decision, it can change the outcome. And that's why taking action earlier, when your brain still has access to those sound details, can make a meaningful difference in how well you hear long term.